Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a PT assistant. Today, I am interviewing Rick Olderman, who is a physical therapist, on different back pain questions that our audience had for him. We are going to talk about things like sciatica, stenosis, disc herniations, and many more. So, without further ado, here is Rick. All right, so we're going to get into the next questions about stenosis. So, what are the best exercises for spinal stenosis for a 75-year-old who cannot get on the floor, and how often should you do them?
Okay, so this is a really good question because I often get questions about specific diagnoses like stenosis. Okay, but then what about spondylolisthesis? Okay, but then what about spondylolysis? Okay, but what about a herniated disc? All right, but what about a bulging disc? And so I get all of these kinds of questions about, and what we're trained to think of our injuries and our diagnoses as the stenosis is a separate and different injury than a spondylolisthesis or a bulging disc or a herniated disc. But in reality, they're all due to usually the same pattern of dysfunction. All right. So let me show you what I mean by this. All right. So if we go back to this idea of patterns of dysfunction occurring in the body that's contributing to pain. If you have spinal stenosis, which means that the canal through which your spinal column or spinal cord is traveling, if the bone starts to encroach on that spinal cord, all right? And so what you'll find is that anytime you are more extended or tall, your pain increases. And that's why you see a lot of people with spinal stenosis walking around like this, bent over, because the more that they come up tall, the more extension their spine is going through, and therefore it impinges that spinal cord more from that bony change. And then, but if spondylolisthesis, which is a minor fracture in the spine bone here, also has the same pattern. Arching increases pain because what it's doing is that force is driving the vertebra to move forward and therefore impinging tissues. And so these people also might be bending forward, or both of these categories of diagnoses find relief when their knees are bent or their knees are hugged to their chest. That feels wonderful for these people. Well, frankly, it's the same that goes for a herniated disc or a bulging disc or a multitude of other names of diagnoses, right? They all fall into the same pattern of dysfunction because the general pattern is the more I arch, the more my back hurts, regardless of the structural reason for that, whether you have stenosis, spondylolisthesis, herniated disc, bulging disc, it doesn't really matter what that structural issue is. It's the pattern that's causing that structural issue to hurt that matters, okay? So for those people with spinal stenosis, if I say, well, just start standing up taller, you're going to say, no, that really hurts me, right? And so what we have to do is remove the forces that are causing this stuff to hurt if you do stand up taller. So what are one of those forces? Well, if we stand up taller like this, what has to happen is that the pelvis should come back with the spine, all right? If the pelvis remains forward like this and you try and stand up taller, then you're going to only accentuate the problem, okay, the pain. And so what we have to make sure is that when you stand up taller, that the whole pelvis can stand up taller too. All right. Well, what would prevent the pelvis from being able to come up tall? Well, it would be these thigh muscles in the front of the legs, first of all. They start at the knees and they attach into the fronts of the thigh bone here. And it's very often that these muscles become tight, especially if we're sitting a lot. And if you have spinal stenosis, spondylolisthesis, all these other types of stuff, and your pain is relieved when you're sitting, well, then if the more that you sit, the shorter these muscles become, right? And then when you stand up, they stay short, and then they pull that pelvis forward, causing the back to arch and causes your pain. So stretching out these thigh muscles is a big deal for people with spondylolisthesis, spinal stenosis, things like that. And then also, I go back to the old big problem for a lot of people is when we lock our knees, when we stand and walk, that inherently, even without this tightness, that will tilt the pelvis forward, causing more arch in the back. So there's an easy one. Just stop locking your knees when you're standing and walking. which will reduce the force of the pelvis rotating forward and reduce the extension forces that are acting through the spine. So there's an easy one. Another easy one is I have a thigh stretch in my home program where you start with both legs up at your chest, you hold on to one of them, and then you drop one leg down over the edge of a table or a kitchen countertop or your bed or something like that. And what that's going to do is it's going to stretch the thigh muscles while protecting the spine. Most thigh stretches don't protect the spine and the pelvis when you're stretching the thigh. It allows the spine to arch more, which then you get out of that thigh stretch and it hurts. Well, the thigh stretch that I recommend doesn't do that. It controls everything. So you're actually truly stretching the thigh muscles. And most people feel wonderful after stretching those thigh muscles if they have any of these conditions and arching is hurting. So that would be my big recommendation. If you can't get down on the floor, well, you don't need to. First of all, just stop locking your knees when you're standing and walking. And you should notice that pain, that ache in your back has reduced significantly. And if it hasn't, then you've got to stretch these thigh muscles because that's one of the things that's pulling everything forward, causing the back to arch, and therefore contributing to more pain.
I'm assuming my next question is going to have a similar response then.
Yeah, see, and this is why I always sound like a broken record, Mike.
Yeah.
Because really everyone keeps asking about these diagnoses when really it's the pattern that's contributing to the structure that's the problem, not the diagnosis itself.
All right. Well, thank you for joining us again. Where can people find more information about you at?
If they go to rickolderman.com, I have lots of free stuff there. I have some blogs. I have all my home programs, my practitioner training program, and there's a contact form there, of course, for me that you can use to reach out if you like.
Okay, perfect. Well, thank you for joining us.
My pleasure, Mike. Thanks for having me.